Hi, I'm Caroline Hastings. I'm a pediatric hematologist-oncologist. I practice at UCSF Benioff Children's Hospital, Oakland. I also serve as a senior clinical advisor to CTD Holdings and am on the scientific advisory board and co-chair the listening circle. So my story with NPC begins approximately 10 years ago. At that time, I met the Hempels and their lovely identical twin daughters who were toddlers at the time. And they presented to me with enlarged spleens that were identically enlarged and to date had had an extensive evaluation, but no obvious etiology had been determined. At the time of their presentation, it was also apparent that they were neurocognitively affected. And so, of course, it narrowed our spectrum of possible diagnoses down. And shortly thereafter, the diagnosis of Niemann-Pick Type C was made. From that time, after a discussion with the Hempels, at which time I told them about the gravity of the disease and lack of truly treatments that could change the course of progression of disease, we then embarked on going further with the clinical trial. And we at first wanted to see what was available as far as participation in clinical trials for possibly new drugs, but we quickly found that there were none. So what happened at that time is then the Hempels decided to embark on a truly innovative path and bring together clinicians and scientists and pharmacologists and biochemists and create a treatment plan for their children. They found out that there were some innovative discoveries that had just been made at UT Southwestern. They contacted Dr. Benny Liu, who was working with Dr. John Dietschy, and he had made the seminal discovery that in mice, hydroxypropyl cyclodextrin impacted positively NPC mice with respect to reversing the defect as seen in the liver and brain tissue, and also prolonged life. So that discovery, though very early and in a mouse model, prompted them to go down this road of really that they went down rather passionately and aggressively to use the drug in their children. They asked me to partner with them, and I certainly was interested in helping them because the disease was really known to be a fatal one without any kind of intervention. So they then put together a team and invited me to participate on that team. Creating the first protocol for administration of cyclodextrin to the twins was a very long and complex process. It took approximately a year and a half of hard work. And the team consisted of the Hempels, myself, a pharmacist, biochemist as well. And we also contacted CTD Holdings, who provided us with Trappsol Cyclo and a lot of information about compounding of the drug. We then contacted Johnson & Johnson and were able to get some extensive toxicology data from them related to their use of the drug as an excipient in a number of other drugs that they use. So all of that data together helped us put together a first treatment protocol in which we were able to determine dosing and intervals, and we submitted that to the FDA. We then worked with the FDA rather extensively to complete the protocol and initiated the first treatment with intravenous cyclodextrin in April of 2009. After administering the cyclodextrin intravenously to the twins for approximately a year and a half, we then introduced a new route, which was intrathecal, and we delivered the drug directly into the central nervous system by performing a lumbar puncture and infusing the drug in that manner. We opted to add that because we had certainly concerns about the disease progressing not just systemically but neurocognitively, and felt that by addressing two different routes that we were optimizing the use of this drug. The Hempels developed a website and posted the protocol, and the intent was to reach other families and clinicians who are treating this very rare disease and let them know about our early efforts. On the basis of that protocol being available on the web, we received many inquiries around the world and shared all the information as we gained it. We shared our safety information, our outcome information. Physicians and parents contacted me directly, or they contacted other members of our team, and we worked with them and we helped them understand the protocol and the pros and cons of doing the treatment. The first patients to contact us internationally were 2 children and their parents from Brazil. And their physician, Dr. Vieira, was very interested in treating those children with the cyclodextrin. So he utilized our protocol and pretty much mimicked it, and we're doing it in approximately the same time period. So over the years, we have continued to share our findings as far as how the children are responding to the treatment and any potential problems related to the treatment as well. They were able to procure the Trappsol Cyclo as well from CTD, who supplies this internationally to other physicians who may want to utilize our protocol. Now it's been 7 years. The girls have done very well. We've seen some clinical improvements. Niemann-Pick Type C disease is a systemic disease. Patients may present with evidence of liver or lung involvement, for example, or enlarged spleen, or they may present with primary neurologic or psychiatric disorders, or there may be a combination. So I do believe it's going to take treatment that addresses all of these systems in order to effectively treat the disease. It's this thought that really leads me to include intravenous and intrathecal treatment in the current compassionate use studies. However, I do believe it's very important to study intravenous Trappsol Cyclo independently. And the reason is that we don't really know what the mechanism of action is in humans. We have hypotheses based on cell models and animal models in different species, but we really have to be very careful to extrapolate that and assume that that's exactly what happens in patients. As well, we don't really have ideal dosing and interval assessments. And the reason that we need to do these studies as well is we need to look at the pharmacodynamics, or how this drug affects organs, and in particular the liver. And this will give us information as to how quickly as well that we can expect to see change and how prolonged that may be. And this will give us really important information for dosing and intervals going forward.